What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Today, we have a very special guest, Dr. Terri Fox. We're going to talk about mold, mycotoxins, mycotoxicosis, aspergillus, all the stuff, the clinical sequelae that follow mold and mycotoxins.
While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
Welcome to the show, Dr. Fox.
Thank you. Thanks for having me. I'm excited to be here.
Absolutely. So, did you have personal experience with mold, or what got you down the mold rabbit hole?
Yeah, I mean, I think almost all of us that do this have a personal experience. When my son was 12, he's 20 now. He's almost 21. Anyways, I think he was, no, I'm sorry, he was 12. He was 8 years old. And he was one of those like just thrill-seeking maniac, fearless little boys jumping off things and going too fast. And he started limping and like limping when he'd like walk down the stairs sideways. He'd get stiff after a long car ride or in the mornings. He got like new anxiety he'd never had. And then he put on a bunch of weight. He was this like scrappy underweight kid and he put on like 30 pounds on his little 8-year-old frame. And so I was testing him for everything. I didn't want it to be Lyme because I had ventured into the Lyme world at that stage and was treating patients, and they were definitely my hardest patients. So that was like the last thing I tested him for, and it was positive. I think I tested myself first, and I was positive, and then I was like, well, anyway. So I tested him, and we were both, I think, LabCorp positive, not even
Oh,
IgG.
wow.
Yeah, I grew up in Virginia, so I was not surprised. And so then I realized he had Lyme. I started down the Lyme treatment road. And then I went to see Dr. Stephen Harris in California, and he gave us a mycotoxin test, a real time lapse mycotoxin. And so we brought it home and we did it, and it was through the roof. And that was my first entry into the world of mold. We got a good indoor environmental professional out, and we found 3 feet of water under our entire house, in the crawl space, but under the vapor barrier. And so it was the same year as the Boulder flood. So like everybody had flooded and our whole street had flooded and we thought we were fine. And then, the airborne spore traps had like Stacky in the red, which, you just don't see very often.
Right.
And so, yeah. So then, we had to start on the remediation, train, that whole thing. And then I didn't believe my son was going to get better in that house. And so we sold it, and my marriage didn't exactly make it out, but Kai did really great as soon as we got him out of the exposure.
Awesome. Yeah, something with Colorado. I was, interviewed Dr. Jill Carnahan. You
Oh,
know
yeah.
her? And, I think she had to move her office twice
Yeah.
from, various mold issues. And I mean, at least here, I mean, you're from Virginia, so but in the Southeast, they put up a framework and they may not come back for 2, 4, 5 weeks. And it's raining, 2, 3, 4 times a week during the spring and summer. And so you have a structure that's already conducive to mold growth. and then you expose it to 5G Wi-Fi routers, and they're just shooting out the mycotoxins.
Yep, 100%.
And so your son, he's doing well today?
Yeah, he's doing great. He recovered completely. Yeah, super active, running marathons and studying chemical engineering. Yeah,
Awesome. Awesome.
doing
And did you have symptoms from mold?
good. Yes, I am very mold sensitive as well. I think as a mom, when your kid is 8 and sick, you don't focus on yourself all that much. But yeah, I had insomnia. I wasn't sleeping at all, probably coupled by my anxiety about my kid. And I had anxiety like through the roof, which I don't normally struggle with, and lots of migraines.
Yeah.
Oh, and I
Yeah.
dropped weight that I didn't need to drop.
What was that last part?
Dropped weight. So my
Oh, you
son
dropped
put on
weight.
30 pounds and I dropped like 15 and I didn't need to drop a one. So I looked
Really?
emaciated.
Because I know I've seen the data where you take an adipocyte and you expose it to like interleukin 6, TNF alpha, it doubles in size.
Right,
Um, so I've seen people put on weight because the saying, I'm not fat, I'm inflamed.
right. You're diluting the toxins.
Yeah. And I
Yeah, I
think
don't
some
know.
people who get sick from the or have side effects from the GLP-1s, I think that's part of it is, they're dumping body fat. And so they're dumping a lot of toxins
I
and they
agree.
don't have support for phase 1 and phase 2 in
Yep,
the liver. And then they're just retoxifying themselves.
yep, I agree. I think that if they have a lot of weight to lose, they should be on some organ detox support and, a few other things to support. A lot of liver support would be great.
So what treatments do you use for mold? Do you follow more of the Patricia Kane lipid exchange protocol? Do you use binders? Do you use a combination?
So I have my own mold eradication protocol that I've created out of treating it for 15 years and figuring out what works and what doesn't. So I do my mold treatment. I separate it into two phases. So phase one is binders, and I pick the binders based on your mycotoxin results. So different binders work, have a different affinity for different mycotoxins. So you want to make sure that you're on the right ones for your unique mycotoxin load. And I add in some liposomal glutathione, some organ, kidney, liver, lymph detoxification support. I do a nasal spray, a compounded nasal spray, and then I have them start one binder at a time and then work their way up to full dose, making sure that they feel nothing or better. And if they feel worse, they decrease it and try it again the next week. And then once they're on full doses of binders, having daily movements, they're sweating, they're figured out some of the other biotoxin relief modalities, and they're feeling either nothing or better. And it's been now 4 weeks on the full doses, and I layer in phase two, which is antifungals and biofilm.
Okay. And
Yeah.
so nothing for like TUDCA for bile, or do you use something
I
different?
do sometimes, yes. Sometimes I'll do TUDCA, I'll do bitters X as well,
Okay.
for some additional bioflow. And milk thistle is in the beginning of phase two with antifungals, some either milk thistle and sometimes a lot of other liver support.
And the nasal spray, what are the ingredients in that?
I start with BEI, so that is the I is itraconazole, the E is EDTA for biofilm. The itraconazole kills mold, and then Bactroban is an antibacterial, and that's mostly because when you start opening up the biofilm, if there's mold colonized in the sinuses, it's often mixed flora, so the Bactroban will kind of help clear the rest of it out. And then if they're on that one for a long time, I actually get it compounded without the Bactroban, just EI nasal
Okay.
spray. Mhm.
Okay. Awesome. What's your favorite go-to lab for urine mycotoxin testing?
Yeah. I love real-time labs, although I find it to be very specific. So not a lot of false positives with food and that sort of thing, but not terribly sensitive. You can miss a decent amount with it, and I find it needs to be provoked with a pretty heavy provocation.
Yeah.
Yeah. And then I also like Vibrance mycotoxin. That one I think I've come to trust. Yeah.
Yeah. I like that one too. I've seen, I'm trying to think of the guy's name, but he talks about the antibody test. But my thing with the antibodies is that's showing an immune response, it doesn't show the total body burden. And you can have both, but you could have one without the other. And people say, oh, well, it could be from food, but if it's 5 times the normal range, that's unlikely to be from food in my experience.
Yeah, I agree with you 100%. To me, that feels like, okay, you've got antibodies to common molds. So your
Yeah,
body's seen them, you've formed an antibody. That doesn't tell me anything about whether or not there's mold in your system.
right.
Might tell me, that your system is very reactive to it if the numbers are high. That I did hear a counter argument to it. Something about like if the titers of how high the antibodies are, that might lead you to believe, but I don't know. I don't use that one either. I feel the same way. It's like you have an IgG antibody to EBV and to
Right.
mycoplasma because we've all had them.
Right.
Yeah,
Exactly.
yeah, it's
And
a
so when people come in and let's say they're not having 2 bowel movements per day, what do you do to help stimulate peristalsis in the GI tract?
Yeah, so it's the reason Dr. Tim is asking me this is because you have to have daily complete movements in order to get better. That's how we detoxify, so we can get toxins out in the urine, the stool, and the sweat.
Mhm.
And binders are constipating, so that can make it even harder to get it out in the stool. And you can be doing the whole protocol and get on tons of binders. And if you haven't, because the binders just stay in the GI tract, bind toxins and then pull them out in the stool. And if you have incomplete evacuation, then those binders just, not the binders, those toxins recirculate in the system. And then the next day you've got twice as many. And also, like, you didn't get anywhere and you're doing this complicated protocol that's not exactly cheap. And so it's super important to have daily complete bowel movements. I usually start with the basics. I just start with magnesium citrate. If they find they need more than like 4 magnesium citrates, then I'll switch them to, do you know, Colinex?
Mhm.
I often will use that one. And then I like Bowel Mover by Cellcore. I
Yeah.
like bitters for
Mhm.
peristalsis. You check their thyroid and everything else, make sure there's nothing else. And
Yeah.
then, occasionally you gotta like hit a little yeast or a little parasites if the parasite is, I mean, if the constipation is so bad that you really aren't getting anywhere.
Right.
Yeah.
Yeah,
Do you
so
have
let's talk about that. I'm glad you brought it up because I read it in, your form that you
oh,
submitted with your answers. Someone who spent probably 50 to $70,000 trying to kill Candida back
mhm.
in like 2006, before I was really trained and had studied mold. Um, if you have mold, you're going to have Candida. So you're not going to get rid of the Candida until you get rid of the mold, correct?
Oh, um, it's going to be a lot harder because mold creates all the right conditions for yeast to flourish. They're both fungal, creates all the right pH, like everything else. So there's, in my opinion, um, every mold case has a yeast overgrowth, and every case gets, like it's a part of their healing journey. And sometimes I find it's a huge part when we hit the yeast. And,
Yeah.
sometimes smaller, but and especially the MCAS patients and stuff, like it's can often be a huge part of the case. And not only that, in the water damaged buildings, there's Candida on the, if we do plates and stuff, you see lots of different kinds of yeast as well. Um,
Right.
so I treat it with something called low dose immunotherapy. Have you ever worked with LDI at all?
Yeah, like Dr. Ty Vincent.
Yeah. Okay. So that works a bit on tolerance as well. And so I will do it when there's still mold. I'll start a yeast LDI. Now, I do find sometimes like we'll find their dose, their magical dose, and then once we've cleared the mold, it's not the right dose anymore, and we have to go a little stronger.
Yeah.
But sometimes, yeah, I can still sort of find the dose with the mold there, and they can get a big layer of symptoms taken off. So, yeah, do you use the yeast LDI?
So I haven't. I played with it back in the day. I need to revisit it.
Right.
But I was also going to ask you about the SOT therapy. Have you used that for Lyme and
No.
non-invasive? So I've interviewed at least 3 doctors now who are using it. Dr. Beth McDougall, she's been doing functional medicine since 1998. And she's having great success with it, but they call it a vaccine. It's not really a vaccine, but it blocks the DNA replication sites. And so you have to have a positive Lyme, Babesia, or Bartonella test within the past 6 months for them to create the
Block
vaccine. What's that?
replication. You said it blocks the replication.
Yeah, the DNA replication sites. So it's not directly killing anything, but
Hmm.
because all the microorganisms have a lifespan, it's going to work by not directly killing them, but blocking the replication. So then
Right.
they die off. And I asked her, I said, well, has anyone relapsed? And she said, no. Like she's been doing it for, I don't know, 5 or 6 years or
Really?
more. Yeah. It
Are you
goes to the RGCC lab
okay?
in Greece. And so, yeah, her and a naturopath in California, Dr. Chelsea Zarkon, and Dr. Cece Brooks, who's a DNP in Atlanta. They're all using it with great success. Now,
That's
you
cool.
can't do it for all the bugs. I think there's a few strands of Bartonella you can't do it for, meaning the
Okay.
lab just can't, for some reason, they don't have the ability to create it. But if you send them like, it can be any test. It can be the Vibrant Tick-Borne Complete 2.0. It can be MDL, Medical Diagnostic Labs. But it just has to be a positive test within the past 6 months, and they'll create it. And then you just infuse it. You do one pathogen at a time every 2 weeks.
Okay, hang on. They're taking the bugs that they find on one of the tests that we do for Lyme and Lyme co-infections, and they're making it from that, not from the person's actual bacterial load.
Right.
Okay. For a minute, I thought you were describing it as autologous, and I was like, "Oh wow, I didn't know."
As a what?
Yeah, like autologous, like they were
Oh, okay. Gotcha.
samples and then make it with their strain. I was like, "Wow, I had no idea."
No,
Anyway,
no.
yeah, so they're
Um,
just and they've had a lot of success. That's cool. I've been
yeah.
hearing I had a couple patients do it and didn't have success, but who knows who they went to and that sort of thing.
Yeah, and that's what they all three basically said the same thing. Some people are doing it incorrectly, and I didn't get into the minutia of what incorrectly means. But I do know, like, for example, Dr. McDougall said, if you have Bartonella, you want to do it for Bartonella first, and then Babesia, and then Lyme, um, just because of the hierarchy of the organisms.
Would agree. I would get the BART first.
Yeah, exactly. And I mean, I think the price varies from like 4,000 to 6,000. Um, but you can easily spend double that in herbs in 1 year. And then, you may
That's
make
for one.
traction. What's that?
That for one SOT.
I think so. Yeah.
And are you supposed to do multiple?
Well, so like if you did Bartonella today, you would wait 2 weeks, then you would do Babesia and
Oh,
then
you just do
Lyme.
the BART once to
Yeah, you
start.
just do it one time.
Okay.
It's just a one-time infusion. Yeah.
Interesting. Interesting. All right.
And they all three, I mean, raved about
Like
it.
that Beth McDougall. Maybe I should talk to her about it. Oh, and
Yeah,
I listened to the podcast. I saw that one on there.
she's great. She does a lot of energetic testing as well.
Okay.
Um, and I'm going to interview her. She has a neurophysiologist, and she was telling me, for example, they had, I think it was a kid 10 to 12, and they had been bitten by a tick, but they tested the tick and it was negative for Lyme. But then the neurophysiologist did the brain scan, the baseline QEEG, and it was a low voltage brain, globally low voltage. And so it was hallmark signature for Lyme. And so that's when, they send them back to Dr. McDougall and the other providers, and then they address that because they know the brain won't change a ton until you address the bugs. So
Yeah.
yeah, I can connect you with Dr. McDougall.
Sure, that'd be great.
Yeah. So I just didn't know if you'd tried it, because as someone who spent a ton of money on herbs and IV, I mean, I think 10 pass ozone can be great, but at the same time, one of my mentors says you can't kill your way to health, you know? Like you should do some killing, but you can't just kill, 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 kill and expect to get better. I used to practice when I was in North Carolina out of the building, in the movie Under Our Skin with Dr.
Oh,
Jimsick.
Yeah.
Yeah, I used to practice out of that building, and he had people, IV antibiotics, which I mean that's fine, but a lot of times they would get worse and not better.
Yeah.
And so, yeah, I think the SOT has good promise, but I'm not trained in it. So,
Yeah. Yeah. So, does somebody have to fly? Like, are there just a couple places in the country?
so you would either have to fly or find a provider because I don't know if there's a provider in every state. Um, and I would personally want to look for someone, with a good track record of success. I know Dr. McDougall has people flying in from like other countries and stuff.
Oh, wow.
Um, So, yeah, I think it shows great promise. And because it's working on blocking the DNA replication, I mean, you still obviously want to work on mold and mycotoxins and jaw cavitations, but you can get started with that right away. And it frees up immune resources to address the other issues.
Oh, that's interesting. Huh.
Yeah. By the
So,
way, I don't own stock in the lab or anything.
okay. All
'Cause people
right.
are like, "Oh, you're pumping this SOT really hard. You must own
Right.
it."
Have you
I'm
just
like,
sort of learned about it recently? You're excited.
yeah, well, I mean,
Yeah.
I knew about it for at least 5 years, but I didn't know how good it could be. I guess because some of the people I talked to, they didn't really know the details of it. I'm a minutia person, like I want the deets. And so after I interviewed, three people in, 6 months, and they were all raving about it. So I was like, this has to be good if they're all raving about it.
Yeah, yeah, that's cool. It's exciting.
There's
Uh,
also innisphoresis, which it's not legal in the US yet, but hopefully it will be as of 2026. But it's, literally like blood filtration. It's
right.
different than EBU, but you can send the toxins off to the lab to determine what toxins have been filtered.
Oh, well, that's cool.
Yeah.
Interesting.
Do you use peptides in your practice at all?
A little bit. They're getting harder and harder to come by.
Yeah.
But yeah, I do some peptides. I have like a different approach with Lyme. So I find that most people with Lyme that have it chronic, that's active and chronic, that there's usually a reason, and I'm sure there's reasons that we don't know about yet, and there's genetics and all that stuff. But what I find is so there's like top five treatable things that will allow Lyme to remain chronic and active in the system. And so, for example, mold, tips the balance completely. It's such a complete attack on the immune system. And then Lyme reactivates and becomes opportunistic in the presence of mold. And so I always treat the mold first if there's mold there, and then kind of see how the patient is clinically. And then I always do yeast because there's always yeast in a mold case, and most of your Lyme patients have been on antibiotics at some point or another. And then I'll do parasites and environmental toxin loads, heavy metals, that kind of thing.
Okay.
Um, yeah, and so and gut, do a good stool study and a food panel and clean up the gut so the immune system can function better. And I find about 95% of my Lyme patients, the Lyme goes into dormancy when I do all of those things. And if not, then by the time we get to antimicrobials, whether it's herbs or LDI or antibiotics, it's like quick. They don't need multiple different antibiotics for years and all that.
Do you do oral antibiotics or IV?
If I end up on antibiotics, just oral, sorry, not IV.
And what do you do for mast cell activation? Do you use ketotifen or
Probably the same things that everybody else is doing. I do double up on antihistamines over the counter, take, a couple different ones in the morning, couple before bed. I like hydroxyzine for a lot of those patients. And then, do you know All Clear? It's the one made from quail egg. It's a mast cell stabilizer. That's from Integrative
it's all
Therapy.
clear?
Yeah, ALLQLEAR. And then I use diamine oxidase. I use Hist Aid, the pump by Quicksilver. I use Masties occasionally. I use quercetin. I will call in ketotifen and cromolyn sodium. Not everybody does great on them. And then to be completely honest, if I have a patient with a lot of MCAS that's like not able to eat more than 5 foods, I will start down the yeast LDI road sooner because a lot of times when I get the right yeast LDI, a lot of the MCAS symptoms go away. And then
Yeah.
I'll also layer in the nervous system rebooting, whether it's limbic retraining or vagal retraining, because a lot of times they just won't budge with the MCAS. They're so inflamed and there's, histamine in their brain and they've got leaky brain and just, they react to everything.
Do you
Um,
use any of the vagus nerve stimulation devices like the Hoolist?
so I recommend the True Vega a lot. I like that one. I've had some good
Okay.
success with it. And then I've told patients about 2 or 3 of the other ones that I've heard from colleagues, but I haven't worked with much of them myself. Which one did you say?
The Hoolist, I don't have it up here, but it's like this big. You apply it right here. It has 5 different settings.
Yeah.
Um,
You like
and it
that?
was made by a guy. Yeah, I love it. It was made by a doctor of biomedical engineering who had social anxiety when he was in his PhD program at Arizona State. And so I've had mine for like a year and a half, and I have a colleague in Atlanta who's a chiropractor and a nurse practitioner. He does a lot of brain rehab, traumatic brain injuries, and he uses it on patients and with good results to stimulate the anti-inflammatory reflex. So peristalsis, like if someone's not pooping, I'll have them do
Oh,
that.
ah,
Other things too, but that can really be helpful to get the bowels moving.
yeah, that's great. That's great.
Yeah.
Yeah, stayed with that one. So is that one that the patient buys or that you have in your clinic and rent
They
out?
buy it online. We have a discount code, but they
Oh,
have a 60-day money back guarantee.
ooh.
So the only money you're paying for is the shipping fee, really. But I haven't had anyone. I don't think I've had anyone send theirs back
Oh,
yet.
that's great.
Yeah.
Now I have to
So
look at
it's around like four
I
hundred
think it's
dollars.
on my list that I give to patients of different vagal things, but I haven't experimented with it myself.
Yeah. And do you have people do like the DNRS or the Primal Trust?
Yeah, so I have, a few guides and all this stuff that I hand out, but DNRS, Gupta, Primal Trust. There's an app called Curable that I find is really good for chronic pain. Um, and then Safe and Sound Protocol, Truvaga. A lot of the other vagal stimulators, I have them sort of all, listed out, the ones that most of my colleagues like. I think that one that you named is on there too. I think that's most, I feel like I'm forgetting one. I mean, I tell people they can experiment with EMDR with a good therapist. See if that is there, everybody's different and what works for them is different. Or neurofeedback they can try.
Are you
Yeah.
familiar with neural therapy, like the procaine injection into the scars?
Yeah. 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 Yeah.
So, Dr. Suzanne Faree in Atlanta, she used to be on faculty at Emory. She's big into peptides and she's very cutting edge, but she does that to reset the autonomic nervous system, into scars. But she does it like a very thorough physical exam, and so she'll do it into trigger points. She'll do procaine IV first to sort of get the body to accept the therapies that follow. Because if you're in fight or flight, obviously you're not going to really accept the therapies, even if they're good. What's
Okay.
that?
Do you do a procaine IV first?
Yeah,
Huh.
yeah.
And
So she
then,
does it IV. She also does it into directly into scars because of the interference field that it creates.
uh-huh. Ah, that's interesting.
Yeah,
Fun, huh?
I haven't tried it yet, but I plan on doing it. Why
Yeah,
not, right?
try it. I love all
Yeah,
that stuff.
because I mean, I've learned the hard way. People can do mostly the right things, if not all the right things, but if they're in fight or flight, their body's not going to really be able to accept and utilize the therapies.
100%. There's people that they just won't get there if they don't feel safe and work on some of the trauma.
Yeah,
Yeah. So like
absolutely.
ones, right? The
Yeah.
one. I mean, I recommend every mold patient do, limbic retraining, vagal toning, whichever both, works for them. But especially like, the mold patients with the MCAS, like they're just stuck from it. Like they just won't progress and get better unless you get them feeling more safe. And
Yeah, and if they've been on some of the antihistamines really long time, it's depleting acetylcholine, and the vagus nerve needs acetylcholine to work.
yeah,
So,
an awesome answer at all. It's one of those real tricky things because MCAS will make it very hard for some patients to be able to progress in a mold or a Lyme protocol because they'll react to everything. They'll have an adverse, paradoxical reaction to everything you give them. And so then you have to, try to stabilize the mast cells and lower the histamine levels so they're not so reactive. However, the actual root causes of that MCAS is the mold and the Lyme and the co-infections. But sometimes if you're blocked
the
by the
vicious
MCAS,
cycle.
you gotta hit it from the beginning and yeah, see if you can then start getting at the underlying actual cause.
Yeah.
Yeah.
And so, what do you use to treat Bartonella? But basically, do you do IV therapy in your office?
Yeah, we do a lot of IVs here. I do a lot of IV phosphatidylcholine and glutathione. I do that that's like my favorite. I do that for all mold and Lyme patients, until they don't seem to get any more benefit. We have NAD and, all the regular stuff. So your question was what antibiotic choice would I use for Bartonella?
Or herbs or methylene blue or anything?
Uh, so like I said, I generally try to do all the stuff first. So, we do a stool study, we clean the gut so your immune system can function, we clear any mold, clear any yeast, clear any parasites, do a little environmental toxin testing, heavy metal toxin testing, do all that stuff if we still have Bartonella flaring. And I mean, it's pretty clear to see it's when it's
Yeah.
flaring, it's not fun, Bartonella.
No.
That no, not at all. I often will start with one of the herbal combos, like MC Bar One from Beyond Balance. I don't think I've gone back to the Byron Whites in many, many years because they were just so strong. But I'll start with like MC Bar One. If that's too much, then I might try Hatunia or some of the other herbs just on their own. And then we see where we get with that. So if I can get them to where they're asymptomatic on some number of doses, then I'll layer in some of the things to get at all the different phases of BART and, all that. But I'll, stick with the herbs that they're working. I love methylene blue. I use it for BART and all kinds of mitochondrial function, all the like polyuria and interstitial cystitis. But it's a fun one for Bart. And, then there's just all the regular combos of antibiotics. I usually start with Bactrim and just see where we get. And then, if I can get them on an herbal, successfully, sometimes then I don't need as many other agents in the pharmaceutical
Right.
realm. Sometimes you do, sometimes you don't. But, you kind of do all the work you can to try to not damage the microbiome too much.
And then
Um,
with the LDI, you can't do that and do killing at the same time, can you? I was told that you couldn't, or you're not supposed to, because I'm trying to think of the reasoning. The way they phrased it
I
was,
did do it. I was trying to think. So usually I'm choosing one or the other. Like if it's a younger kid, like a teenager or a college kid, and they're not, able to follow a complicated protocol, then I'll go, and or maybe they have chronic nausea. The kids today with Lyme all have chronic nausea and they can't swallow pills easily. I'll start with LDI. But I've actually used LDI to get people off antibiotics. So, I find especially my PANS, PANDAS kids, like It can take years to clear the BART. I mean, I don't want anybody out there to hear that and get bummed out, but I mean, they feel better once you get to a certain part, but then they can't come off of them. They just get completely symptomatic again. And so what we've done with several patients is I've tried to find the BART dose, the strep dose, the BAB dose, and then, you have to do all those one at a time and find the dose. And then when we find it, then they taper off their antibiotics and they do a lot better. So
And
I
then
don't,
they typically stay on the LDI for
I mean, that's so
indefinitely.
easy. It's one squirt under their tongue every 6 weeks.
Yeah.
Yeah. I mean, they
Oh,
don't
it's
mind
only every
at
six
all.
weeks. Okay.
Yeah.
I
Once you
was
find
thinking
the
it
dose.
was more frequent than that.
Mm-mm. No, it's so easy once you find it. It's just the dance to find the right dose.
Yeah.
Yeah.
Awesome. Um, what do you do for PANS, pandas? Because Lyme can be a trigger for PANS and pandas, right?
Yeah, so PANS pandas is they're both autoimmune encephalitis, which is an autoimmune disorder where your body forms antibodies to your own neurotransmitter receptors in your brain, and it's caused by an untreated infection. And so, depending on which autoantibodies you have to which receptors, you'll get a different set of symptoms. So, like if it's a dopamine receptor versus a serotonin receptor, you can get anything from anxiety, depression, and brain fog, but there's often OCD, there's often involuntary muscle movements or tics. There can be anger and aggression and emotionality turning on a dime, very libel. It's
Mhm.
not the right pronunciation, that's the other libel. Anyways,
Lab
uh,
mood,
pardon.
lab mood.
Yeah, exactly. And so pandas is the one that's caused from untreated strep. And then PANS is caused from other untreated infections, most commonly mold, yeast, Lyme, and Lyme co-infections. And so it's almost like not exactly the same as MCAS, but there is a certain amount of calming down the neuroinflammation that I do before I start getting at the underlying root cause, just so they can tolerate it.
Mhm.
Um, and then you're trying to determine is strep in the picture? Is it mold? Is it BART? Which thing is triggering the autoimmune encephalitis? And those are the ones that I find probably end up on antibiotics more and longer,
And do
unfortunately.
you do well, so with PANS and pandas, you do the antibiotics. Do you do IVIG or do you test the IgG subclasses?
100%. I test the the IgG subclasses in every patient that has Lyme or mold or any chronic illness. And if they're low, then I absolutely get them IVIG. I think it works better than anything else. And we just passed legislation in Colorado that autoimmune encephalitis is now um, diagnostic code that you qualify for it, whereas it never used to be. So it's it's still jumping through a lot of hoops to get it, but yeah, I think it
Yeah.
definitely works better than anything else. I don't
What
think you
about,
for
sorry, go
autoimmune
ahead.
encephalitis. I don't think you can get it for autoimmune encephalitis in most states.
Yeah.
So you have to have like the low IgG or something else to qualify, but it's amazing.
Do you use low dose naltrexone at all?
A bit. I have patients ask me about it all the time, and I have a few patients that swear by it and love it. I feel like, maybe 15 years ago, you threw it at everybody and it only stuck with less than 1%. So then I kind of forgot about it for a while and it seems to be
Yeah.
making its way in the media again. So I've been playing with it again. How about you? Do you use
Gotcha.
it?
Yeah, I've taken it personally since like 2010,
Hmm.
just more prophylactically than anything else. I mean, I did have Lyme and co-infections and mold, but now it's just more prophylactically. Um,
So then,
so yeah, and I mean, I feel good, so I don't plan on stopping. I don't think I will, but I know it doesn't obviously work for everyone. I take it in the mornings because I'm one of those people. It did disrupt my sleep and my body didn't adjust.
uh-huh.
So I know back in the day, people would say, well, if you don't take it at night, it won't work. But it's not
Oh, I
true.
don't think that's true. I just think it makes a lot of people sleepy in the morning. But
Yeah.
for some people, they can't sleep on it. I mean, that's a common issue too.
Yeah, absolutely. So what are you planning to do with your practice? Anything new in the future that you're excited you're working on?
Well, yeah, I just created a online mold treatment class for patients. So I've been treating molds for 15 years and however long it's been. And I get calls from all over the world, and I can't treat people in other parts of the country legally. And so I developed a course that people could do on their own. And it's very, easy to follow. 35 modules are short, but like it's very guided and handheld and step by step by step. And it's, 20th of the cost that it would cost to come see me and do your mold, treatment here. And my goal with that was really to just try to get the information out into the world because I feel like mold is becoming more and more common. You and I know some of the reasons why, right? But I'm not sure all the reasons why. We've always thought it's 25% of the population, but I don't know about you, but it feels like more than that to me
Yes.
now. I have college kids, like so many of them, and I just don't think there was a bunch of undiagnosed mold sick college kids when I was in college. I just don't.
Yeah.
Anyways, so yeah, I developed it to try to reach a much bigger audience because it's not that complicated to treat mold, but a lot of people will try to treat it and make themselves worse. They'll do things in the wrong order, they'll use the wrong binder, they don't know how to get themselves having movements, or, if you start an antifungal in the beginning, you're gonna, when you kill any colonized mold in the body, it releases its contents, which are more mycotoxins. So if you start off with an antifungal, you're going to flood the system with more of the very same thing that is making you sick. And so, there's kind of an order that's really important, but I don't think it's, complete rocket science. I think with a little guidance, people can do it. So yeah, I'm excited about that. I did a live version last summer, and we're about to relaunch it as a do-it-yourself or a version with Q&As with me twice a month.
Okay, awesome.
Yeah.
What's something that you know today that you wish you would have known 15 years ago?
15 years ago. What can I do too?
Yep.
Um, well, one, it would have been really nice to know that we could have been treating women with estrogen. That's a huge one. That's changed everything. And this might be a funny answer, but do you know what plasmalogens are?
Yeah, I have some on the way right now. Dr. Gooden now.
Love with them. I wish I knew about those 15 years ago. I think they're,
You take them?
yes, I love
Okay.
them.
Mine should be in the mail. There should
It's
be
like,
arriving today or tomorrow.
do the loading thing. And so you can really tell.
Yeah. So I
Oh,
interviewed him and he's a super smart guy.
you guys, you interviewed him on here too? I'll go listen to that one.
Yeah.
Yeah, I met him at the Longevity World Conference. Yeah, my whole office went to his booth. We were like groupies. We were like, oh my gosh.
Yeah. And do you still take them now or did
I
you stop?
love them. Yeah.
So you do the prodrome neuro in the morning, the prodrome glia in the evening?
I do the Glia before bed. I just do one. I could probably try two again, but for me, and everybody's really different with it, and they help different parts of the brain. But the Glia, I sleep better if I do one. I sleep worse if I do two, which I don't know what that
Really?
is. Yeah, I've had other people say that as well. And then in the morning, for the Prodrome Neuro, I do four generally, but I went up to six for a few months.
Okay.
And it's incredible for cognitive function and your energy level. Like, I mean, your processing speed increases. Like you can feel it. It's amazing. It's
Have you
very,
ever tried cerebral lysing?
no, I never have, but I would love to.
It's awesome.
Oh, really?
I only did one vial because you typically inject the whole vial IM.
Oh,
Um,
over
you
4 weeks.
do it one full, you just draw it all up because it
Once.
comes in like a beaker. It's not in a vial. You break it open, you draw it all up, shoot it in
Unreal.
the glute, and like you literally could have told me that you were gonna steal every last dime I had, and I'd be like, okay, well, I'll recover. Like I was just so
Wow.
resilient.
Wow.
Dihexa is also good. SS31, Motc are really good. Um,
Where are you
Cortexin's
getting,
good.
where are you getting your
So
vet?
I'll tell you off when we're
Okay.
not recording. Yeah.
It's,
Um, but yeah, they're all good. But yeah, that's cool that you know about the plasmalogens. Do you use them in patients?
yeah. And I'm experimenting. So what I found so far is the older the patient, the more dramatic it is. So like I've tried it with some patients with intense cognitive dysfunction from mold, but they're in their 30s and they didn't feel any difference at all. But almost every patient over 50 I've given, it's like, oh my gosh. And then it's really good for concussions and it's good for the heart. Um, excuse me, sorry.
Yeah.
And um,
Mast cells.
hmm, yes. And I've been just beginning to experiment in the last couple of months of my pandas patients.
Okay.
Because I'm curious to see if you replace all that plasmalogen. So your brain is 70% fat, and in a healthy brain, 30% of that fat are plasmalogens, which is a kind of a fat. And so, it's kind of like you're giving your body the thing you need to replace the parts that are old and not
Right.
functioning optimally and all that stuff. And so, I mean, there's so much neuroinflammation in pandas. I've always wanted to ask Dr. Goodnow if he knows if he's tried it with those patients yet. I think I have three or
Yeah.
four on it right now. I'll know in a couple of months if it's doing anything.
Well, you probably know this, but he reverse aged his own brain 17 years using the plasmalogens.
How did he measure that?
I know he has I think it's on his website, but on his Instagram page, he has like the brain scans, and I think he did neurocognitive testing,
Okay.
and a few other things. But he had it all right there.
Huh. So, yeah, he has a prodrome scan. It's a blood draw that you can see, how your fats and stuff are, but I don't know how he some kind of cognitive function test he did
I
that
think
he,
so. Yeah, I think that, and
I believe that.
I don't know if a spec scan, I mean, that shows the activity, but I don't know if it would show any improvements per se. So I'll have to ask him.
Yeah. Yeah, that's so fun.
But he seems, he has a lot of integrity, so I trust
Yeah.
what he says.
Yeah, yeah. Yeah, I love those things.
Well, awesome. Thank you for the work that you're doing. Where can people find you if they want to become a patient?
Oh, sure. So if they want to become a patient, it's boulderholistic.com. If you're interested in the mold course, it is drfoxmedicaldetective.com.
Okay. Awesome. Well, thank you so much, Dr. Fox, for the work that you're doing. And we hope to have you back on in the future for some updates.
Oh, great. Well, thank you so much. And thanks for having me. And thanks for the work you're doing.
All right. Take care. Have a blessed day.
You too.